Welcome to Leveraging Partnerships to Develop Interprofessional Geriatrics Training, presented by the University of North Texas Health Science Center at Fort Worth. My name is Tracy Butler-Carroll, and I'm joined today by Dr. Jennifer Severance. And our co-authors on this presentation are Dr. Janice Knabel and Dr. Leska Hadley. Our learning objectives for this presentation are to identify opportunities for interprofessional geriatric education provided by a HRSA Geriatric Workforce Enhancement Program, and also to employ innovative partnership strategies to enhance training in social determinants of health for medical students, residents, and practicing primary care health professionals. Please note that the projects that we're going to tell you about today are supported by a grant through the Health Resources and Services Administration, which is a part of the U.S. Department of Health and Human Services. The contents of this presentation are the responsibility of the authors and do not necessarily represent the official views of HRSA or HHS. According to the U.S. Census Bureau, at the link listed on this screen, the population of those aged 65 and older is expected to more than double between 2012 and 2060, from 43.1 million to 92 million. Older adults will represent just over 1 in 5 U.S. residents by the end of this period. The Pew Research Center reports that the U.S. already leads the world in the number of centenarians, followed by Japan, China, India, and Italy, and projections suggest that there will be 3.7 million centenarians across the globe by 2050. As people reach the age of 65 and older, there's an increased need for more healthcare coordination from multiple providers, for long-term care, and for institutionalized care. In addition to geriatric syndromes, such as falls and malnutrition, which often lead to acute healthcare problems, older adults can also suffer from a range of cognitive impairments that can impact their ability to be active participants in their own care. Additionally, older adults face a range of chronic conditions, such as the ones shown on this screen, which are the leading cause of death in older adults. Unfortunately, according to an Institute of Medicine report, the American healthcare workforce will be woefully inadequate in its capacity to meet the large demands for healthcare services for older adults if the current patterns of care and the training of providers continue on their current trajectory. Directors of geriatric medicine fellowship training programs report that, on average, only 64.6% of first-year fellow positions were filled between 1995 and 2017, and the percent of filled positions dropped to 44.6% in 2017. Several healthcare reform proposals have recognized the need for more geriatrics healthcare professionals and primary care providers to meet the unique care needs of older adults and better prepare direct care workers and family caregivers to do the same. Not only is there an acute need for a geriatrics workforce, but these future medical professionals must be able to work collaboratively and navigate across systems of care, working in interprofessional teams to address the diverse needs and social determinants of health of this older adult population. At this time, I'd like to hand this presentation over to Dr. Severance to tell you more about how our institution has risen to meet these needs.
Thank you, Tracy. I'm Jennifer Severance. And as Tracy said, preparing a workforce to address these complex needs requires collaborative partnerships and innovative solutions. In 2019, the University of North Texas Health Science Center received a grant as a Geriatric Workforce Enhancement Program, or GWEP. We're one of 49 in the nation funded by the Health Resources and Services Administration to develop geriatrics training and education. This program is called the Workforce Enhancement in Healthy Aging and Independent Living, or WeHAIL program. As a GWEP, we focus on several things. Focus on expanding training into rural and underserved areas, expanding the use of telehealth technologies, and fostering healthcare and community partnerships to address social determinants of health. And finally, we seek to create age-friendly health systems and dementia-friendly communities. Another important element of this work is evaluating training knowledge, skills, and attitudes, and measuring health outcomes about process changes in patient care. The WeHAIL program is partnered with a private university, 2 osteopathic medical colleges, a county hospital system, and a wide variety of community organizations, all listed here, to train together students, medical residents, and health professionals about geriatrics healthcare. With these partners, the We Hail program aims to impact the workforce and the quality of care for older adult patients and improve patient and family engagement, health outcomes, and health systems. We'd like to highlight some of these partnerships and outcomes today. These are 6 major objectives that the We Hail program is focused on. Our partners work collaboratively across 20 different projects within these 6 objectives. We'll dive more into these objectives on the following screens, but the primary purpose of this program is to develop geriatrics training that's focused on improving health outcomes for older adults. And this is done in 3 primary ways. First, we want to integrate geriatrics best practices and tools into primary care. Second, we want to transform clinical training through integrated geriatrics and primary care delivery systems. And then third, we want to maximize the engagement of patients and their families as active partners in their healthcare. So for the purpose of today's presentation, we will highlight 5 training programs that demonstrate innovative approaches to accomplishing these 6 objectives.
First of all, the SAGE program that was created with a dual purpose to increase early exposure of healthcare students to older adults in order to provide a better understanding of geriatric care through firsthand experience, and also to provide an interprofessional team experience for health profession students. The SAGE program was started in 2009, and it impacts more than 1,300 students every year across 8 health professions from 2 different universities. SAGE places students into interprofessional teams and pairs each team with an older adult volunteer to complete 4 visits over the course of 1 year. During each visit, students practice basic clinical assessment techniques, they focus on specific topics geared towards geriatric health, and they receive valuable feedback and input from their mentor. These visits used to be in person, but thanks to COVID-19, the SAGE program moved to a telehealth approach. So we're connecting our student teams with their senior mentor via telephone or video calls. On their 4th visit with their senior mentors, students collaboratively develop and provide evidence-based teaching on a health or wellness topic to the older adult using appropriate health literacy strategies. Over the years, the topics of these presentations have included diabetes, nutrition, Alzheimer's disease, COPD, joint pain, over-the-counter medications, lung disease, advanced directives, arthritis, and many, many more topics. One valuable lesson that we've learned from this program is the value of diversity within our older adult volunteers. Geriatric patients come from a variety of backgrounds, socioeconomic representations, education levels, races and ethnicities, religions, and even their health status. Some of our senior mentors are very active and very healthy, have no chronic diseases or take any medications at all, while others depend on full-time caregivers. They may have many chronic diseases and they need more coordination of care to meet their daily needs. Every student team's experience is different based on the senior mentor that they're paired with, and we encourage our student teams to debrief at the end of SAGE to share their experiences. We also have a geriatric residency, and this rotation provides supervised, high-quality opportunities for our residents to apply and transform the medical knowledge and basic clinical skills that they have acquired into clinical competence in the care of older adults, while functioning as learning members of an interprofessional healthcare team. Over the course of their 4-week rotation, JPS Health Network residents increase their competencies in the age-friendly health systems 4M's framework by participating in tasks and resources specific to each objective: what matters, medication, mentation, and mobility. They're exposed to a variety of geriatric care experiences during this rotation, including ambulatory practice, home visits, geriatric psychiatry, and long-term care settings. They also participate in self-study and case reviews, and they receive didactics from our geriatrics faculty at the university and geriatrics leadership at their health systems. One of the activities that they have an opportunity to participate in is Dementia Live, which is a dementia simulation experience that immerses the residents into the life of a person with dementia. As a result of the simulated experience, residents have a deeper understanding of what it's like to live with cognitive impairment and sensory change. Over the past 3 years, over 150 residents have participated in the Dementia Live experience. One valuable lesson that we've learned during the geriatric rotation is the need for coordinator support. In order to see patients in our clinic, residents must be set up for access ahead of time in our electronic health record. They must also complete appropriate paperwork, receive details about parking on our campus, and they all have busy clinical schedules to coordinate between our clinics and their own hospital schedules. And without coordinator support to handle all of these moving parts, the residency activities would not be possible. A third program I'd like to tell you about is our rural medical education program called ROAM, that's designed to prepare students for life and practice in a rural and/or underserved community. When students begin their clinical rotations in year 3, they're expected to spend a majority of their time at rural clinical sites under the supervision of a family medicine preceptor. During this rotation, students are asked to complete a quality improvement project at that rural clinical site. Each project focuses on identified needs of the site's older adult patients within the 4Ms framework. This project is broken down across their 12-week rotation into 4 phases. The introductory phase is when students complete online training about the IHI 4Ms and also about QI strategies. The planning phase is when students work with their clinical preceptor to identify a process that could enhance care for the older adults at that site. Phase 3 is the implementation and evaluation phase, when students implement their improvement activities and track participation. Lastly, the assessment and conclusion phase, when students collect final outcome data, draw conclusions, and they write an abstract paper on their results. Each student is encouraged to submit their abstract to local, state, national, and even international conferences, showcasing their QI projects, and many students have been accepted. Looking to the future, we're planning to get more feedback from the rural clinical sites that can help us know how this project impacts their clinic, and if there's more information that we need to provide that can help them be involved in the project and support the student. And Dr. Severance will now tell you more about our other projects.
Thanks, Tracy. This 4th project is called the Geriatric Practice Leadership Institute. This is a 6-month online training for interdisciplinary healthcare teams, and their training prepares them to be clinical leaders in their organization by providing them with skills and knowledge to design and implement a quality improvement project based on the Institute for Healthcare Improvement's Age-Friendly Health Systems framework. Now, this framework has been mentioned in other training programs, and what it does is guide organizations to assess care for older adults they serve in each of the 4Ms areas. The 4Ms include mobility, medication, mentation, and what matters. And being an age-friendly health system means adopting person-centered processes and evidence-based interventions in each of these 4 areas, and to align each area with the patient's needs and preferences. Geriatric practice leadership teams complete online modules and assignments to plan a QI project in any one of the 4Ms that aligns with their strategic direction within their organization. They're also paired with a professional coach who offers teams their support and guidance. GPLI teams represent a variety of organizations and healthcare professions. And the key lessons we've learned is that with this diversity of learners, we need a team of coaches to provide expertise on a variety of topics, whether they be clinical or operational areas of interest. Our team is now looking at different engagement strategies to ensure the variety of learners we have in GPLI are getting the most of this experience. This final project that we'll talk about is called Project ECHO, and this is a collaborative model that comes out of the University of New Mexico. And the model provides medical education and care management that empowers practice team members in rural and underserved communities to provide specialty care to more people right where they live. The Project ECHO team is comprised of clinical and non-clinical faculty among several disciplines who meet with healthcare teams who work at other sites and discuss specialized healthcare topics and to learn together through patient care presentations. Also in this year, the ECHO team has provided short 10-minute recordings of their didactic sessions about the age-friendly care topics within each of the 4 M's, and these are available online and using the link. They are also holding office hours to visit with sites in more detail about specific patient care challenges they're facing. We currently offer 2 ECHO lines, the Geriatrics Education line for primary care practices and the Nursing Home Strong ECHO for nursing homes. And in this next year, we are focused on continuing to recruit teams from primary care and nursing home sites across the state and the region. During the first 3 years of this 5-year WeHail project, the collaborating organizations have expanded training to reach over 1,900 interprofessional students, as well as 58 additional medical students at 25 rural practice sites. Our results also show over 150 family medicine residents participated in residency training, including the dementia simulation experience. And additionally, 80 health professionals graduated from the Geriatric Practice Leadership Institute, and 87 healthcare professionals at rural primary care practices and nursing homes participated in training using the Project ECHO model. Evaluation data was collected on each of these projects, including trainee demographic information, feedback from trainees on usefulness and intention to use, and suggestions for future activities. We also measured pre-post the trainee knowledge, skills, and effectiveness as a result of the training. Trainee feedback demonstrates improved knowledge, confidence, and attitudes in providing geriatrics care and connecting older adults and caregivers to needed social supports. As seen here, 81% of SAGE students rated the value of the SAGE program to their future practice as good or excellent in the fall of 2021. Also, 93% of medical residents agreed and strongly agreed that they were more confident about their knowledge of healthcare needs of older adults. 92% of Rome students stated they agreed or strongly agreed that as a result of their quality improvement training and project, they better understood the importance of quality improvement to determine whether patients' needs and expectations were being met. Also, 83% of GPLI participants agreed that their training was useful for their career goals. And finally, 82% of geriatric ECHO participants agreed or strongly agreed that information from that activity would be incorporated into their medical practice. So in summary, the WeHail Geriatrics training program that we provide exposes our trainees to interdisciplinary interactions and multiple settings of care, including in the home, outpatient, and inpatient. We have built partnerships along shared goals, building on the strengths of our team and partners, which has enabled our work groups to create training models that can be replicated in the care of similar populations across different settings. By applying a national initiative like the IHI's Age-Friendly Healthcare Framework, our faculty have a proven structure to adapt and organize best practices and tools in geriatrics care. And finally, we've designed processes to share training feedback for quality improvement and to demonstrate the impact of geriatrics training through patient and system-level outcomes.
We would like to thank our WeHail leadership team listed here on this slide for their tireless efforts on this grant and the many projects that we have. We could not do this work without them. If you have any questions or would like to contact us, our website and email address are also listed on this slide. Thank you for your time today.